that is currently fucked up, and we are going to try to rebuild Dave Tate. You know, over the years, trashing the body, doing world-class things under the bar, it takes its toll. Dave's dealing with some big orthopedic issues, and after going through some of his medical history, some of his training history, and his current training status, we have some work to do. That's why I'm here at the elitefts headquarters, and we're going to be spending an entire day assessing, evaluating, and getting a game plan to move Dave Tate forward. All right, so we broke down everything on the table. We got the subjective history. Really, the next step is to look at a 30,000-foot view down, like you're on a fucking airplane and we're looking down globally at your movement. Now, this is a humbling experience, don't get me wrong. Like, this is something that is not a pass or fail. We're not putting you into these positions being like, holy shit, you can't do that. What I'm doing is putting you into provocative positions so I can yield as much data as possible throughout the screen and the assessment strategy. So my eyes looking at you means a lot here. So though we might not be able to get through all of these movements perfectly, that's why we're fucking testing it.
What do you want the speed of movement to be?
So I'm gonna let you do exactly what you are inherently gonna do. So I'm not gonna bias you by any means. We're gonna go through something called a functional movement screen. It's gonna kind of be put together a little bit differently because of a lack of equipment here, which is really ironic here of all places, but we're gonna set you up in 7 foundational patterns. Basically, we're gonna look at the capacity of the patterns, but more specifically for you, because we know we're dealing with some pain issues, I want you to communicate back to me what you're feeling. I'm gonna look at your function. I'm gonna go through check marks in my head to look at the quality of your function. You need to say what you're feeling back to me. That is gonna dictate a score, but the score is not the biggest thing for us right now. The total score doesn't matter in my mind. What I wanna do is lay a foundation, a baseline of where you're at right now, so we can get a really good idea where we go in clinical assessment, but also trying to reprogram some of the accessory work, some of the prehab, rehab work, and then the dynamic warm-ups that we have with your programming.
Yeah.
So we've done this over 10,000 athlete times. So this is something that we see a lot of through the squat, through a hurdle step, through an inline lunge. We're gonna do a push-up test. We're gonna do something called rotary stability that's on all fours. And we're also gonna be going through a couple mobility screens, which is active straight leg raises, which Dr. Serrano said I had to be really, really nitpicky on with you. And then also shoulder mobility. Again, we know we have these deficits, but this is just a baseline start. And you know, for coaches going through this, if we do identify pain, you know, it's really important that we go in, we know where the source of pain is coming from, we use our referral systems. And hey, if you don't have pain or you have dysfunction, that's within your wheelhouse. So we're gonna start with a deep overhead squat. The way that we're gonna position this, I can't even say that with a straight face, but the way that we're gonna position this is feet are gonna be shoulder width apart. You're gonna be off of that for right now. So you're gonna step up a little bit here. We're gonna position feet shoulder width apart. So the inline of the foot here is gonna be up with the armpit. We're gonna have the toes facing straight forward. We're gonna have the dowel on your head and then up towards here.
It's not gonna happen.
We know it's not gonna happen. We're gonna get in the best position possible, and then we're gonna score the test from there.
Yeah.
So I'm gonna give you the dowel. You're gonna be at 90 degrees.
And that's it.
Cool. So from this position, we're gonna go down and we're gonna squat.
I mean, I can do that. Do you want that or do you want this?
You're gonna score the same either way.
All right, all right, we're good.
Yep.
So now what do you want me to squat?
So we're gonna squat, we're gonna pause for a split second at the bottom and then come back up.
All right, so you wanna know about the pain, right?
Yes.
So my upper back and shoulder hurts like a motherfucker.
Cool.
All right, now you want me to squat?
Yes. So this is red flag sign.
Okay,
So
first off, there was crap, you heard my shoulder, right? All right, so right there.
This is great. Okay, come back up. I just wanted to make this a point. We knew that you weren't going to be able to get into this position, but if you don't get into these positions, like let's hit a check mark on this box and say, hey, orthopedically, we have to look at this shit.
Some meets that would pass though.
It's not good enough to be like, oh yeah, I can kind of hold the dowel like this, and if I move my arm like this, my leg like this, I can squat.
Yeah.
In a testing procedure, you know, we hit 0, which means there is pain. We go red flag sign, and that's something that we're going to look at clinically. So if coaches are testing something like that, Like, holy shit, we better know what's going on there. If we have multiple pain signs, we have knees cracking like crazy, and we're not able to go down into that squat pattern. So usually we'd have your heels elevated and all this shit. We're not gonna worry about that because we're gonna go back in later on after we get the assessments done, and we're gonna look at your foundational movement pattern development, and we're gonna get you into your squat. We're gonna see how you're squatting with your setup, with the way that you're using the bar, the way that you're creating tension, and we're gonna look at it from that standpoint. So we're gonna let this one go and move on. So the next one we're gonna look at here is we're gonna look at something called the hurdle step. The hurdle step is so important for you because multiple times in the table we heard, yeah, you know, I had really great results. That one time I elevated my heel 3 or 4 inches and I did step ups. That's cool. Are you training single leg stance right now? No. Do we have some problems with hip, groin, lower back? Yes. This is all single leg natured foundational movements. So we're gonna test this thing. So the way that I want you to set up here, again, you can see that we have the benches. I think they're at about 16. We measured Dave already here, but we have him at about his tibial tuberosities. We're gonna leave this here. You can actually just hold it here because we're not gonna get you into that position. We're gonna have feet together. We're gonna have knees straight. You're gonna be gazing out in front of you. You're gonna come over, you're gonna touch down, and you're gonna come back. And again, anytime that you're testing this kind of stuff, I'm gonna be standing right there next to you, so you're not gonna just trample over these awesome benches.
Yeah, I'm not gonna fall. This okay?
Yeah.
Like this?
So we're gonna go feet together. We're gonna try to align it where, go feet totally together so they're like touching. And then let's go over with the right side to start with here.
Can I take my feet apart first? Or
Nope.
I gotta start from here?
You have to start from this position. Again, these are provocative functional positions. Good. So anytime you're assessing movement, we're trying to look from multiple planes here. So I'm going to look from the front here. Again, these are global movement patterns. We're going over at the right side again. Good. And one more time with the right. Good. All right. So kind of reset yourself. Again, this isn't a standard position, but we just know that we're having some of those restrictions coming back with the bar on your back. So we're going to reset everything. We're going to go over with the left side this time. Keep your gaze kind of coming out this way.
God damn it.
Okay, reset everything. Let's go for it again. Let's reset the feet. Go one more time. Good, all right. So a couple key things we're looking at here. Objectively, does the leg go over? Does the foot touch down? Does it return back? Yeah, we did that. That's objectively, but subjectively, we're looking at human movement here. We're looking at capacity at single leg stance. We're looking at the way the core is integrating with the hips and the lower extremity, and we're looking at the compensation patterns. That's really the most important thing here. Again, this wasn't a standardized position, but it's not about that. It's about getting eyeballs on human function. And this is a really good starting point because you're the kind of guy that will find a way to do these tests. If you can get into the position, you're gonna find a way. And those are some really heavy compensation patterns that we saw there. That's good stuff because again, that's data for our spreadsheet that we can go in and we can use to prioritize your training weaknesses. Money. Let's go on to the next one here. So we're gonna do an inline lunge. The way that we're gonna set this up is we're gonna move these over here. We're gonna use this line to put our feet right in the middle of. So right in these partitions. I'm gonna take this from you. And again, we're gonna align you in a split squat stance that's gonna be a narrow base. I need to take a measurement off your tibial tuberosity here. So again, we're going at about here. So what I want you to do, so see this notch right here? I want this toe back on this line. So move this foot back, and I want your midline of your foot right on this line, this one. I want this heel to be in the middle. I want it right on this notch. I want you to, as well as possible, you're going to get this foot straight in the back. See how you're angled out in abduction? I want you to move your heel back towards me here. Again, go a little bit more. So again, if we can't get into a standard position from an FMS standpoint, we're not going to be able to score it properly. But again, we're going to look at some human movement here. Mm-hmm. We already have the restrictions that are happening at the shoulders moving into rotation. We're going to look at them independently of one another here in a second. So we're not going to get you into the functional internal external rotations on the dowel. Yeah. But from this position, I want you in a slow controlled manner. You're going to split squat. You're going to touch your back knee down to the ground, just grazing, and then coming up into a standing position again.
You're out of your mind. Now come back.
Yep. Good. Let's reset everything. Let's switch sides on that one. We got what we needed out of that. Yeah, right on that notch. So again, looking at split asymmetrical stance here. Try to move your toes a little bit more towards the midline on the back foot. Good, right there. Let's go through that same split squat. Back of the knee comes down.
Heels up.
Yep. Okay, cool. So just from an objective standpoint, this is what I'm looking at. I'm looking at the inability to touch the knee down. That's number one. The second one, the criteria, is really to have more of a vertical angled torso. That means that we can stack the hips a little bit better. We can use the pelvis in an authentic, non-compensated way. Second thing is not coming down and actually resting on the ground, or the third thing I should say. And then really the lack of getting in that position from a rotational standpoint at the hips, that's another thing. It's like, we're going to test this out from a clinical standpoint. I know that felt like shit.
No, fuck yeah. The knees
like
are
I didn't
the
even
worst.
have to ask you about your pain on that one.
Yeah,
because,
the knees are the worst.
So the knees really led in from the hips and the torso angles, everything just heavily compensating. And that's the kind of thing that, again, we're going to look up chain from more of an orthopedic assessment standpoint. But that's a really good baseline for us to be like, hey, that's a standardized single leg split squat assessment. And really using something like this, like as an orthopedic indicator lift, knowing very well that we're going to go in and we're going to meaningfully train single leg, that's something that in our progressions down the line, you're going to come in, be able to at least position yourself and execute a little bit more with the quality. So, doing okay here?
Mm-hmm. No. No?
We're going to go through and we're going to get this from an assessment standpoint on your shoulder internal external rotation. This is something definitely clinically that we're going to look at, but we're going to start off by doing functional internal and functional external. So that combines multiple positions of the shoulder all at one movement. So the way that you're going to go through is you're going to have an open hand and you're going to come through and you're going to come up as high as you can and you're going to touch down and you're going to try to touch the scapula on the opposite side of your back.
If I dig it out first, it will be
So it
better.
has to be one smooth movement, and I want you without anything that happens before. So we want your most authentic movement here.
Okay.
So no modalities happen before.
Okay.
Modalities are going to happen later with us.
Okay.
Because we're going to get in on you. We're going to do some soft tissue. We might drop a couple needles, do a couple joint mobilizations here and there. That's the time to test the modalities. Right now is the time to test baseline.
All right.
So you're going to have feet together.
The feet aren't going to matter on this one, I'll tell you that right now.
So let's face towards here. We're going to start with your left side, okay?
Yep.
So your neck's going to stay in neutral, your spine's going to stay in neutral, hips are going to stay in neutral. You're going to reach that left arm over and you're going to touch down and try to hit right about here. Cool. So again, we're seeing compensations come back. So keep everything neutral, no compensation. Let's do this side again, okay?
Yeah.
So we're trying to go for the spine of the scap, which is a bony prominence right about here. You can see Dave's like 2 or 3 inches off. And then one more time, I'm just going to look from the opposite side here just to watch the scap move. Cool. All right, cool. So this is looking at functional external rotation. So the shoulders moving, the glenohumeral joints moving into external rotation. We're coming into flexion, and then we're also doing adduction back towards the midline here. So we kind of set a standard here for functional external rotation on the left. We're gonna compare that to the right side here. We're gonna do exactly the same motion. Go as well as you possibly can. You guys can't see it on the camera here, but just like the pain sourcing on the face. Good, relax it here. It's not good enough to ask somebody, hey, did that hurt? You're usually gonna hear like, ah, it's fucking tight. Yeah, it was really tight. But watch a couple different things. Watch facial expression. You watch secondary respiratory muscles, scalenes, upper traps, pec minor. Do they go like this? Do they tense up? Or did their smoothness or their quality of motion change? Did it start going like this? Those three things, you don't even have to ask anyone if they're in pain. For the majority of people, if they present with any of those three, it's gonna be a pain source. Most people won't tell you. Let's go into functional internal rotation, this time on the left side. So what you're gonna do is with an open hand, you're gonna go back behind your back and you're gonna try to come up and touch the inferior angle of the scap, which is right about here on you, okay? Sure. Keeping everything in neutral. Cool, relax. So we're gonna look at functional internal rotation, excuse me here. So this is as far as you can get up. Okay, let's go on this side. Okay guys, so what we're looking at here, again, is kind of the opposite of functional external rotation. So we're extending the humerus here, we're internally rotating it, and then we're again moving it back towards midline of the body here. So we can see some huge restrictions there. Usually a standardized, notable assessment would be to be able to touch your fingertips towards this inferior angle of the scap. We're not there, we're not close to it, but again, this isn't a pass-fail. This is something that the first one, I saw some compensation patterns. I saw compensation like this. I saw a lot of different things happening to try to elevate up, to try to use the upper back, to try to do anything possible to try to move this into internal rotation a bit more. And we've been through your history too. So you are bench pressing, you're horizontally pressing, but you're doing it without an extension moment and with minimal internal rotation with the shoulder saver. So that's a range of motion that you've been training. And again, we see the deficits in a more of a standardized way here. So this is another one that I really, really am excited to test because we're gonna get you down on the ground, laying on your back. You can put your head up here. We're gonna put your feet down towards here, and we're gonna do the active straight leg raise. This is something that it gets misconstrued because people think it's all about flexibility. It's all about that hamstring flexibility, that mobility. Mobility has become a cure-all in our industry, and it's bullshit. Basically, what this shows is our ability to use the core, to coordinate with the pelvis, to unlock the posterior chain musculature of the body, the glutes, the hamstrings, the calves to some extent. You okay in this position?
Yeah, what I need to know is what you want me to do with my lower back before I start.
So I want you legs straight. Toes are gonna be back up towards you. You can be hands on the ground if you can. Slow and controlled, you're gonna keep the knee straight and you're gonna flex at the hip and you're gonna raise the leg up as far as you can get it. Good, and come back down. Good, keep everything in neutral. Keep it neutral here, slower on this. Good, come back down. One more time, neutral. Good, all right. We're gonna go opposite side here. Good. I want it even slower, slow-mo.
Calves are restricting.
Good. One more time here. All right, cool. So we can come up from that position because I know it feels like shit being down there.
No, I'm fine down here.
All right, we're gonna talk about this a little bit. So it looked like you had like good flexibility. Like probably thinking in the back of your mind, like my leg went pretty far there.
Yeah.
Like it did, but there's a lot of moving parts to get it up to that point. We had external rotation happening at the opposite side. We had the hip flexors lifting off. We had the lower back lifting off. We had a lot of rotation happening even on the side that was moving. So there's a lot of different moving parts. And really when you're looking at the active straight leg raise, again, it's not like, okay, you can move it fast up and down and you can get to a certain area. Usually about 70 degrees is what we're looking for. It's not about that. It's how far can you go without compensating. So first thing I usually see with compensation patterns is that people speed up the process. World-class athletes are phenomenal compensators. You compensate by increasing movement velocity. You have less time to react to it so you can fool your body into moving through positions. That's the first thing I see. When we slowed you down, you lost a little bit of range of motion. Compensation's got a little bit better, but again, we're looking at that from more of an objective standpoint. So if we can test that one more time, I literally want you to move this speed. I want you to make sure this side is locked in. This back of the knee is pressing towards the ground, heels towards the ground, butts on, cores on, arms are down on the ground. I want slow and controlled up with this right side. Right about there is where Dave starts externally rotating. So when you test, make sure you're testing it correctly. Let's drive this leg down. Turn the butt on this side. Core turns on, hands press into the ground. We're gonna come slow and controlled up with this side. Okay, relax. So what you were doing was originally compensating from that first movement. It was like one of these things, driven from lower back extension. Notably different. So take the time to do this stuff correctly, slow everything down, and actually look at what you're looking at. So this again is going to be something that we're going to key in on in terms of unlocking the posterior chain, using it as primary stabilization, and being able to strengthen it properly, because you're only as strong as you can stabilize. Cool, let's come up from there. So we have 2 tests left here. We're gonna get you into a push-up position. We know it's gonna be restricted.
Yeah.
But I want to actually see you get into the position to contact the ground, to get into that prone position and see kind of where the compensation patterns hit. We're not gonna ask you to press through crazy amounts of pain here. I just wanna actually view you going through the process yourself. Because again, this is one of those that I know that hasn't been in your program very much lately, if ever. When's the last time you trained push-ups? Like an open chain or a closed chain?
I mean, hands flat. Years.
Anything with your chest facing the ground.
Oh, I mean, that's every other week or so. I mean, I may use those
Okay.
for neutral grip. It's that grip that's the issue.
So
Or
you've
I'll
been
put a
doing
barbell.
neutral grip push-ups?
Yeah,
Oh, you have, okay.
yeah.
Okay, I was under the impression that you
Or
weren't
I'll
doing
put a
any.
bar in the bottom of the rack and use that.
Okay,
But it's slightly deloaded because of the.
okay, perfect. This makes me feel a little
Yeah.
bit better in testing this position. So let's come down. The way that I want you to start here is you're gonna get down in this position and then you're gonna lower yourself down.
Yeah.
So I want you to start just like this. I want you to pull your hands down. We're gonna try to pull them down so your hands are right at about your forehead height here, okay? Let's just go from there. We're not pushing up yet. Yeah, that's all right. So from where you're at, you're gonna kind of pull your hands down towards your shoulders, kind of more in a push-up position.
What do you want me to do with my elbow? My elbow comes up, I can get here. My elbow stays down.
I want you to try to press your arms. So let's get back into position. So you're gonna press them up a little bit, and then I want you to pull them down. So you're gonna pull your hands down to my hands. You can position however you want at the elbows. I want you to push up from this position.
From this position?
From this position.
It's not happening. Oh, wait. Just chest?
You can do anything.
Like that?
Come back down. Then try like a full body.
Not happening.
Okay, cool. So we're gonna come back up this way. And I want you to pull down. You're gonna come down a little bit lower. You can come down to my hands right here, okay? You're gonna position here. And I want you to link up and push up from this position. Good, and come back down. Pain with that?
Yeah.
Right shoulder?
Shoulder, elbow, fucking everything.
How about lower back, hips?
No, lower back's
Nothing.
fine.
Okay. Let's get you out of that position. We're not going to test that again. The reason to test isn't just to pile you into pain over and over and over again. We can even come up from that position. But we saw what we needed to see there. I heard a ton of joint crepitus. I saw you able to link up and kind of centrate the shoulder a bit and actually press through there. And really a limiting factor that I saw was not at the shoulders at all, but it was at the torso, it was at the hips, it was at these two things linking together in order to allow the shoulders to do their jobs. Sometimes it's the push-up is good to look at, not only from like a pressing endurance standpoint, but how the body links up as a functional unit. The best lifters in the world, the best movers in the world, they're able to link as many segments as possible together so they don't force leak.
Yeah.
And that's the same thing in corrective movement, same thing as functional movement, or if you're getting under the bar in powerlifting. So it's very similar. We have one last test here that we're gonna go through. We're gonna go out of a quadruped position. We're gonna use, again, this midline is gonna be where we're moving. So we're gonna use, so if this is one of these, we're gonna go 2, 3 out. So we're gonna be about this wide apart. What we're gonna be doing is in a quadruped position, and we're gonna have our wrists right under the elbows, right under the shoulders. Knees are gonna be positioned right under the hips, and we're gonna start from there. So again, a width of about 4 inches is what we want at the knees. A width of about 4 inches is what we want at the hands. Perfect starting position. So what we want to do here is we are going to be moving simultaneously the right arm, the left leg to extend out. So the bird dog. But not only are we extending out, but we're going to come back in, touch knee to elbow, and extend out again. And then return to neutral. Let's go right arm, left leg, extend, touch knee to elbow, extend back out. Okay, reset. Okay, let's go again. Good, touch knee to elbow. Good, extend, good. Let's go one more time, reset everything, and go again. Touch knee to elbow. Cool. All right, let's go left arm, right leg, exactly the same thing here. Good. Good. And replace. All right, cool. We got what we needed out of that one. Let's come back up. So what we're looking at here is the ability, again, of the pillar complex to link up. We're putting you into terminal extension, flexion at the hips, the spine, the shoulders coming all together, and it's also a balance and a motor control component staying in that asymmetrical stance. So again, that's really good to look at because the novelty of the ground-based approach is going to be a powerful thing, especially just getting more surface area, more ground contact, and being able to open up. The more surface area your body has in contact with the ground, the less apprehension the body has, the less motor control capacity is needed to actually go through some of these motions. So getting down, being on 2 feet, this is the hardest position to fight gravity in the world. So as we get more surface area on the ground, that allows us to regress some of these movements down as well. So that's something that we'll go through in programming.
Gotcha.
So we're going to go through a couple key screens here. We already know that they're going to be positive, but we're going to show them anyways. First one's going to be a shoulder screen. So you're going to go left arm up on the right shoulder. You're going to reach this. Pain?
Oh, yeah.
Okay, let's go opposite side. Okay, good. We know that one. We're going to come down on the ground. Without this being yoga, we're going to push back into this position. This is going to show hip flexion coupled with spinal flexion. Pain there?
Just in the armpits.
Just in the armpits?
Yeah.
What if you take some of this out of your hands and sit back? Hips lower back?
No
Okay.
pain.
Then we're going to reverse this. So we're going to go up into like this prone press up position.
No real pain.
Good. All right. So that's the full modified, I shouldn't say full, this is the highly, highly modified a functional movement screen. And it's just a way to get some foundations of what we're doing here. So you said like 15 years ago you couldn't get through a full screen. We just did the full screen, knowing very well that we're looking at it from a data collection standpoint. I just saw a lot of things that I didn't know existed in your movement capacity. You surprised me with a couple different things. And other things we knew already existed.
Yeah.
But that's why you screen. You screen so you can see eyeballs and you can start being intelligent about what you do next. A screen is not the be-all, end-all. A screen is a starting point.
Yeah.
It's what you do next is what matters. You can throw it away if you want to, but using what we saw here, we're going to go in and we're going to definitely jump in from a clinical standpoint and bring you through some of these assessments, getting through range of motion, making sure that we look at shoulder structure, hip structure, spinal structure, multi-segment flexion and extension at the spine, and just get a little bit more nitpicky in terms of the pain response.
Yeah.
So that's our next step here. So guys, make sure that if you are working with somebody that has a past surgical history, has a past medical history, has hip replacements, you know what the fuck you're doing before you go and start cranking people's hips in and out. Anytime that you're directing range of motion, that's well within your scopes of practice for a coach. What we don't want to be doing is manipulating positions, forcing people into positions. As soon as you try to manipulate somebody's position, that's no good. So lead them through, because this is well within a coach's scope of practice to do so and look at some of these ranges of motion. So the first one we're looking at is I'm just gonna have you bring